Hi, I'm Phil McNally. I'm a Veteran Service Coordinator at CHR.
Hello, I'm Dr. Heidi Smolka. I'm a nurse practitioner with the Adult Outpatient Program.
What types of hearing losses will you be discussing today?
Well, hearing loss is categorized as either conductive hearing loss or sensorineural hearing loss. Conductive hearing loss occurs when there's damage to the eardrum and middle ear, and it can be reversible with surgery and medications. Sensorineural hearing loss, which is the most common type of hearing loss, occurs when there's permanent damage to the inner ear and auditory nerve. Approximately 15% of American adults, about 37.5 million, over the age of 18, report some trouble with their hearing, and about 10% of the U.S. adult population, 25 million Americans, has experienced tinnitus or ringing in the ears that lasts at least 5 minutes in the past year. So Phil, is hearing loss common among veterans and service members?
Yes, it's very common. The VA hospital itself, the auditory wing has the most patients I've seen. Having taken clients there in the past, it's always full. It's the hardest one to get an appointment at. And if you're applying for disability, sometimes you don't have to go to the local one. You have to go to one further away. The client I'm currently working with now had to go to New York on Saturday to get a hearing test. And that's just to apply for his disability, and hearing loss and tinnitus are the two most frequent disability claims.
Well, we know, according to the CDC, that veterans are 30% more likely to suffer from severe hearing impairments than non-veterans. Military service members have an increased risk of developing hearing loss and tinnitus due to their exposure to high-intensity noises, such as artillery fire, explosive devices that are too close and too loud, over prolonged amounts of times. Those types of sounds can damage the hairs and cells within the cochlear and canal, and they can't repair themselves. So we know that hearing damage can occur at decibels at 85, and some examples of exposure to the military decibels include machine gun fire, which is 155 decibels, explosives are 180 plus decibels, and heavy artillery at 185 decibels.
What are some common signs of hearing loss?
Well, so for tinnitus, it's usually a buzzing or ringing in the ears. If you find that you're having difficulty understanding conversations in a noisy environment like a restaurant, that could be a sign of hearing loss. If you're having difficulty understanding speech over the telephone, or if sounds sound muffled, also, if you have to ask someone to speak loudly or to repeat what they said, and if you find yourself having to increase the volume on the television, that could be a sign that you're experiencing some hearing loss. So Phil, can you tell me, how can hearing loss impact someone's mental health?
Well, we know hearing loss is associated with depression and anxiety, not being able to communicate thoroughly with loved ones, especially in the veterans, and not being able to listen to directions, a GPS. I know I have a guy who can't use a GPS because he can't hear it at the right pitch. Yes, there is an impact on employment. You can only work certain jobs. You cannot be order takers at like a restaurant, or even cooking in the cooking field. You have to listen to other orders, and you're in a loud environment. Your hearing is impaired. You might not be able to listen to anything. What can be done to minimize exposure to loud noises and damage to hearing?
Protect your hearing by wearing earplugs when you're exposed to any loud noises, such as when you're attending a rock concert, auto racing, rifle ranges, or using outdoor equipment. According to the Veterans Administration, they have a policy that all veterans enrolled in VA healthcare are eligible for diagnostic audiology testing and hearing aids. So veterans are also eligible for cochlear implant devices from the VA if they experience sensorineural hearing loss. Regular hearing tests by an audiologist are recommended for veterans. Is there treatment for hearing loss, Phil?
Well, unfortunately, noise-induced hearing loss is permanent. However, hearing aids, cochlear implants, and bone conductive devices may be helpful for hearing loss. Hearing aids are also helpful with treating tinnitus, along with sound therapy, deep brain simulations, and cognitive behavioral therapy.
What can I do in my role to help?
Well, when you ask a person if they've served in the military, instead of asking them if they're a veteran, they may qualify for services. I've worked with many clients throughout the years where they were asked the wrong question. You ask the right question, you can get them services. They can get enrolled in VA services, get their hearing tested, and like I said in the slide before, getting the hearing aids through the VA. One person I worked with for years, he was asked a question the wrong way for many years. He's now in housing because I asked the question the right way. Don't ask if they're a veteran, because sometimes they will not say they're a veteran, but they have served.